So you've heard of Lofty Heights mentioned a few times today. So very pleased to have Olive Quinton with us today, who's the founding CEO of Lofty Heights. So welcome, Olive.
Hello, thank you for inviting me today, and I so wish Camilla and Callie could come to Suffolk and speak to Suffolk County Council. Lofty Heights, we're a social enterprise that I set up in 2012, and the aim at that time was to provide a loft emptying service to address issues around fuel poverty. Because at that time in Suffolk, we've got a large housing stock, and much of it is hard to heat. And my background is in public health, and we were seeing a lot of excess winter deaths due to cold homes. So I set up Lofty Heights with two aims. One was to address fuel poverty, but also to give employment and training opportunities to young people. What we were finding at that time was that there was lots of free loft insulation grants available, but it was people, elderly people, people that may have disabilities, family carers, people with mental health issues, that were missing out on the grants to have the lofts insulated because they didn't have anyone to empty the loft. Pretty soon, though, we started to see that some of the homes that we were asked to empty lofts, and we wouldn't take people's stuff away, but we would find a place in the home to empty the contents of the loft into. And then if people wanted help to sift it and sort it, we could do that. But essentially it was about just making it available to people to sort themselves. But pretty soon we started to discover many cluttered homes, and by emptying the loft, we were adding to their problem. So over time, we've developed a range of other services, and the one I'd like to speak to you about today is our homeward bound hospital discharge service. I'm going to come back to this in a little while, which is some feedback from an OT with regard to her perspective of the work that we do and the difference that we make in terms of hospital discharges. So as I said, we're a social enterprise. We've been working in hoarded and cluttered homes for over 8 years. And we know that the negative impact that this has on a patient's physical and mental health and the cost to the NHS due to delayed discharges. Often the figure £400 per day per block bed is talked about, and that's what we base our figures on. We saw many hospital discharges fail on the doorstep in the days when an OT might take somebody home to see whether they could manage the stairs or make a cup of tea. And so in 2017, I put a proposal together to the local NHS system to say, you've got a problem, we have a solution. So in 2018, we ran a 12-month pilot hospital discharge service, which has resulted in recurrent funding. So we've got 3 years funding from our local Ipswich and East CCG, and we have 3 years funding just agreed with West Suffolk Hospital. Our service is planned around the needs to prevent admission and reduce delayed discharges connected to the cluttered and home environment. And the service has facilitated earlier, safer hospital discharges, reduced the number of delayed discharges, reduced hospital admissions and readmissions, and enable us to provide space in the home so that end-of-life care can be provided and people can die at home. So our service offer involves, and we keep the patient at the centre of everything we do, because as Callie and Camilla were saying, that we have to put the care around the individual. So our service offer is around, COVID has changed things slightly, but this is the way we try and continue to do things, is visiting patients in hospital or doing joint visits to the homes where appropriate to identify the work that's required. to see what the individual wants and to identify any potential barriers to discharge. Whilst we're in the home, we will do checks that the heating, the lighting, the smoke detectors, that there's a water supply, and those ordinary things within the home are available and working. And if they're not, we will report that back to the healthcare professional that has made the original referral. Mediquip is the local provider of beds and mobility equipment. So we work very closely with Mediquip and actually try and tie in our work with the delivery of equipment. And that prevents hospital staff having to leave the hospital in order to go into somebody's home, because Mediquip won't deliver a bed into an empty property. So actually we're saving the hospital staff having to leave site, and we can meet Mediquip at the property. In the home, we will look at the essential areas to avoid the risk of trips, slips and falls, to make sure that access is available in and out of the property, and that's around reducing the fire risk and enabling people a safe escape route. So we will declutter hallways, stairs and landings. We move furniture around to create space for hospital beds or mobility aids to be installed. We also focus very much on cleaning kitchens and bathrooms, so that basic living tasks and personal care can be provided and maintained. And also we spot clean areas where there's a risk of infection, a high risk of infection, or where particularly healthcare professionals maybe need to dress wounds or whatever. We also clear and access. So because often if somebody's been in hospital for any length of time, the bushes leading along the garden path may be overgrown, and that can cause a hazard not just to the patient and their visitors, but also to healthcare professionals and others. It's really difficult. We often get asked, what's the value to the NHS in terms of the cost savings to the NHS? And that's a really difficult one to answer, because we don't know how many more days someone would have stayed in hospital had we not provided our service. Whereas if, for example, somebody goes into a bridging bed or a community bed temporarily while work goes on the home, that's easy to measure, because you could say patient A had a 10-day stay, and 10 times 400 is the figure. So from our point of view, the real cost savings are unknown and they are difficult to measure. However, what we can do is provide information around our referral sources, as you can see on the slide, the number of operational days from referral to assessment, and the average number of operational days that are saved. The other outcomes we have is that we enable care packages to be put in place more easily due to the fact there is a clean and safe home environment, because again, that is often another cause for a discharge being delayed. But also by the fact that we sometimes, and particularly during the last year of COVID, when lots of social workers and others have not been visiting people's homes, we've worked throughout the last year plus, and actually we've been the eyes and ears on the ground. So what we've been able to do is identify additional support needs that are obvious in the home that may not be obvious in the hospital setting. So, for example, excessive alcohol use, self-neglect, early signs of dementia, and other issues. We also flag up if there's minor repairs or major repairs needed within the property. And we have a small carers grant that sometimes, in addition to the funding that we have for our hospital discharge work, if there's a carer in the home that needs some additional help and support, we can use some of that funding to do that. And as we also do house clearance work, sometimes we have decent furniture that we can pass on to people in need so that we can recycle stuff. We'll also fit key safes to enable ongoing care and access to the home easily. And we're very much about working in partnership and making onward referrals to our local Suffolk family carers. We work very, very closely with the fire service, and where individuals are in need of funding, then we make referrals into the various services funds, and also local charities that we know that will fund individuals. So we've got a very good network really, and tap into those areas of support for individuals. So another outcome is that reduced risk of failed discharge and hospital readmission. And some of the barriers that in the beginning, when people are offered that maybe a hospital bed can come in, sometimes people were actually refusing that because they were worried about that once that bed was no longer needed, they'd be stuck with having to pay someone else to sort their home out. So we have step up and step down return visits, and that has very much helped people to accept the help, and again has prevented that discharge or the readmission. We've worked really hard over COVID, and we assisted around about 420 hospital discharges, readmission and end of life care, enabled end of life care during this last year or so. And we saw the need to introduce some new services. So what we've done is now that we will provide and install key safes so that we can do that while we're already on site. So that saves any additional travel costs or somebody else having to come out to the property. Ensuring that the patient's keys are safe and don't go missing, because that happens sometimes, saves additional trips to the hospital to collect and return keys, because we wanted to reduce the risk of us perhaps becoming super spreaders in the community during this COVID time. And it's all really about trying to make life a bit easier. And then we've also now got an arrangement with Mediquip where small mobility aids we can pick up or collect, if that just saves time and just helps things to move on a little bit. The challenges, though, we've got are many. And again, going back to Camilla and Callie and West Sussex, I really envy you in that you've got a really well joined up multi-agency approach, because actually without that, all you'll ever be is a risk reduction service, or maybe add to a person's trauma by just decluttering them and walking away and leaving them. So our challenges are that within our NHS contract, we have up to 4 hours, between 4 hours and 1 day maximum, to try and organise the home in order to assist that discharge. However, we come across many, many more situations where there's 3, 4, 5 days work required. And because there are no kind of pool budgets or anything, if the patient isn't able or willing to pay and agrees to do so, they can stay stuck in the hospital bed for longer until social services are made, a referral. But then they take their time to assess things. So that's a real challenge. And in fact, we're in negotiations at the moment to try and see whether the NHS and the local social care teams actually can together work it out, that where we identify 3 or 4 days work, that actually social services will either do that financial assessment that's necessary to find out if someone is able to pay, or actually if it meets their criteria, so that they will fund the work. So that's a real problem for us at the moment, and a challenge. We get tremendous feedback from hospital social workers, OTs, and everything. So you can read that for yourselves. But while you're looking at that, I just wanted to share a case study with you, which is from an OT's perspective. So I'm speaking in her words. And it's a case where Lofty Heights absolutely saved me, and that's the OT. And so the story was that a gentleman was a new knee amputation. I completed the home visit with partner and established what needed to be moved in the property to allow downstairs living and enough access for his new self-propelled wheelchair. He had a PVC door for access with a tight paving access to the right and a sloping garden down. Unfortunately, the patient was refusing to leave the hospital until a ramp was in situ. So despite all of Lofty Heights moving everything, he still was sticking with the ramp access. The patient did live alone and was worried regarding an emergency. The OT, I couldn't find any suitable off-the-shelf ramp, and even got in contact with Enable Access, who did training here, and ramps were looking at around £800. I contacted Debbie at Stepping Home and Lofty Heights again, who then made a ramp from some wood and MDF, which enabled the patient to go home. I wasn't able to check it prior to discharge, so liaised with community OT, who kindly did. She was satisfied the ramp was safe and this enabled the patient to go home. It not only saved us a significant amount from a therapy perspective and the cost of a ramp, but also saved on the length of his stay and freed up a bed. I will never forget the case, as it was such an amazing end result, thanks to Lofty Heights and a team effort. I cannot recommend the Homeward Bound service and the staff at Lofty Heights enough, especially for those super complex cases where you need to think outside of the box, like this case. And the reason I'm sharing this really is to illustrate something that I feel really strongly about, and that is the need and the importance of partnership working, because cluttered and hoarded homes is everybody's business. And again, we get really amazing feedback from patients and carers who are really grateful for the service we provide, and especially family that are living away. And in fact, we had a situation during lockdown where actually a family member was in America, couldn't get across to this country, sadly, when the mother died. And actually, by being given access to the property, we were able to get the death certificate that had been posted to the mother's property, copied it across to the daughter in America, who then was able to book her flight. And it's all of those extra things, that thinking outside the box, that really does make a difference to both the patients, the carers, and also to the hospital staff. I'd just like to just end up really with this slide, which is, again, I've touched upon it, but I'm very, very proud to be part of Social Enterprise UK. I firmly believe in the value of social enterprise, and how if statutory authorities commissioned more social enterprises, how we could get so much more done in partnership. And the reason I say that is because as a third sector organisation, not a statutory body, that sometimes we can build those relationships more quickly with individuals, because we have no authority, we have no control. There's no risk of maybe them being evicted or their children taken into care or whatever, how they perceive it, because we don't have any of that power. So I just wanted to share this with you, which has cut an extract from a report done by Social Enterprise UK, and just tells you a little bit about what we did during COVID. Has anybody got any questions?
Right, thank you, Olive. I suppose just occurred to me in contrast to the previous presentation, how much involvement do you have with the fire service and district councils in Suffolk?
Right, we have a lot to do with the fire service. So where we see places that are really, really cluttered and hoarded, we will alert the local fire service. We've got a very good link there. And also the fire service have provided us with training and fitting smoke detectors in homes. So when we check a home that there is a smoke detector, is it working? If it isn't, we'll fit a new one. And then we will also provide the postcode of that property, so it's registered with the fire service. So we work really closely together, but obviously together we'd like to do a whole lot more. The district and Borough Council and Suffolk County Council, I've been campaigning and trying to raise awareness for a very long time around the need for, say, a pool budget, so that actually along the lines of what's happening in West Sussex, that we could do something here. But unfortunately at the moment, um, we're getting nowhere fast. And the other thing that we're trying very, very hard to do is to get more involvement with mental health services, because there's such a desperate need around the mental health issues of people that live in cluttered and hoarded homes, that by just decluttering and reducing the risks is actually not getting to the nub of the problem.
Yeah, I think it's probably one of those issues. I think, as you said, it's kind of everybody's problem. But then I think sometimes that becomes a problem because nobody takes ownership of it, and
Yes.
just kind of looks at each other and says, "Well, it's yours," and they think, "Well, no, really, it's yours." And do you think there's kind of an element of that in Suffolk, or do you think there is somebody that could or should be kind of taking control and a lead?
Well, the thing is, I think there is that. I think often, you know, often different organisations that are very protective of their budgets, they're very quick to pass the buck. And of course, it's one of the difficulties we see with regard to, again, it's not a criticism, it's just our observation, is that when somebody's in under NHS care, you know, that's very clear, that's a healthcare need. But when they're in the community, it's a social care need. And it's about being able to get each of those organisations to accept the different bits of that responsibility, really,
Yeah.
and to put some funding to it.
Absolutely. Well, in the chat, Callie and Camilla have said they would be happy to make a date with your colleagues in Suffolk and discuss what they've been doing over in West Sussex. So maybe we could set that up for you. And
That would
yeah,
be fantastic.
that's
Thank you.
good. Great. Well, thank you, Olive. Hopefully you stick around. I think there's a few comments in the chat for you. So and there's your contact details and website. So if anybody wants to get in touch with Olive, you can go to www.lofty-heights.org. So thank you, Olive, and thank you again for your input into the report. Very, very valuable.